Hello and welcome to the Harbridge and Cross Orientation Training Program on the COVID-19 Workplace Policy. Harbridge and Cross is committed to health and safety and believes in order to be effective, health and safety must be cultural and expressed at all levels of the organization. This is our agenda below. 1. Roles and responsibilities of all workplace parties. 2. Communication plan. 3. Workers' rights. 4. COVID-19 hazard assessment. 5. Control measures and procedures when encountering COVID-19 situations. 6. Information highlights including A. Workplace policy location. B. Enhanced workplace sign-in measures. C. Enhanced hygiene measures. D. Information signage. E. PPE requirements. Please note any changes to this policy will be reflected in an information memo posted on the Health and Safety Board. Let us begin. Roles and responsibilities. At Harbridge and Cross there are no free lunches, everyone has a job to do including supervisors. They are responsible for, develop and review the COVID-19 workplace policy including measures on access routes, hygiene, training and communication. Communicate the workplace policy to all members on site via orientation, toolbox talk, or memo. Inform all members on site or have been to site of any confirmed COVID-19 case. Provide workers under your supervision the required PPE. And discipline any member in violation of the COVID-19 workplace policy. Subtrade foremen or supervisors are responsible for providing Harbridge and Cross a copy of your company workplace COVID-19 policy. Sign in and out of the workplaces and keep accurate logs of workers. Comply with the Harbridge and Cross COVID-19 workplace policy. Provide workers under your supervision with the required PPE. And inform the Harbridge and Cross supervisor of any confirmed case, secondary contact, sickness/illness of workers or any positive COVID-19 test result of workers under your supervision. Health and safety coordinators are responsible for assisting with the development and review of COVID-19 workplace policy. Review subtrade COVID-19 workplace policies. Perform site inspections to ensure the workplace is in compliance with the COVID-19 policy and health and safety requirements. Review COVID-19 inspection logs, hygiene logs, PPE, etc. And discipline any member in violation of the COVID-19 workplace policy. Field and office workers are responsible for reviewing the COVID-19 workplace policy and orientation program. Sign in and out when on the job site. Do not report to work if you are in non-compliance with the COVID-19 questionnaire. Use as required specialized PPE to mitigate the spread of COVID-19. Comply with physical distancing and other measures to minimize the spread of COVID-19. And report any violation of the COVID-19 workplace policy. Communication plan. In order to respond effectively to COVID-19 events, all members have a responsibility to inform Harbridge and Cross staff when encountering the following events. 1. All confirmed COVID-19 cases. 2. All secondary contact exposure between a worker and a confirmed COVID-19 cases including those not occurring on the job site. 3. Any sickness or illness symptoms that has not been confirmed from a COVID-19 test. In all these cases, the Harbridge and Cross supervisor will disseminate information to all affected members as well as follow all legislative reporting guidelines including the Ministry of Labor which must be notified within 4 business days of learning of a confirmed COVID-19 test. Harbridge and Cross will notify all workers that have been on the job site within 14 days from the day that the confirmed COVID-19 test has been administered. Workers' rights. In Ontario, all workers, subcontractors, supervisors, support staff members and visitors have 3 basic rights. 1. The right to know about hazards. 2. The right to participate in hazard discussion. 3. The right to refuse unsafe work. If you have any questions or concerns regarding the safety of your work, you must notify the following members. Your supervisor, health and safety representative, member of the Joint Health and Safety Committee or, as a last resort, the Ministry of Labor. COVID-19 hazard assessment. What is COVID-19? Coronaviruses are a family of viruses that cause illnesses ranging from a cold to more severe diseases. Symptoms for COVID-19 are similar to influenza or other respiratory illnesses. The most common symptoms include fever, dry cough, and difficulty breathing. Most people, about 80%, recover from this disease without needing special treatment. Those who are older, and those with other medical problems are more likely to develop serious illness, which can include pneumonia or a risk of death in severe cases. Transmission. COVID-19 causes infections of the nose, throat, and lungs. It is commonly spread from an infected person through respiratory droplets generated when you cough or sneeze, or close prolonged personal contact, such as touching or shaking hands or touching something with the virus on it, then touching your mouth, nose, or eyes before washing your hands. Current evidence suggests person-to-person spread is effective when there is close contact. Prevention. Think ahead about the actions you take to stay healthy and prevent the spread of COVID-19. This includes following the latest travel advice from health leaders. Avoid non-essential travel. Self-isolate, and monitor for symptoms such as a cough, fever, or difficulty breathing, for 14 days if you have traveled outside of Canada. Practice social distancing, proper hygiene and wear face protection, if necessary. Treatment. Most people with mild coronavirus illness will recover on their own. At this time, there is no vaccine for COVID-19 or any natural health products that are authorized to treat or protect against COVID-19. If you have received a flu vaccine, it will not protect against coronaviruses. Control measure and procedure. General requirements at the workplace. Wash your hands frequently. Regularly and thoroughly clean your hands with an alcohol-based solution or wash them with soap and water for 20 seconds. Maintain physical distancing at least 2 meters or 6 feet apart as often as practical between others. Avoid touching eyes, nose, and mouth. Practice respiratory hygiene, and if you have a fever, cough, or difficulty breathing, seek medical advice or care. Stay home if you feel unwell. If a worker is confirmed to have developed COVID-19 through a verified test, the following measures are to take place. Step 1. The Harbridge and Cross supervisor is to shut down the job site immediately and inform all current workers on site of the confirmed COVID-19 case. The job site must be closed for 3 days, or if antiviral fogging is used, for 2 hours, and the job site may reopen the following business day. Step 2. The Harbridge and Cross supervisor is to follow the communication plan and notify all required members, including visitors, workers, and support staff that have been to the workplace within the last 14 days from the day the worker was tested for COVID-19. Use the workplace sign-in book to contact all affected personnel. Step 3. The infected member must self-isolate for 14 days. All members working in close proximity or may have had contact with the infected member must self-isolate for 14 days. All other members are to self-monitor for symptoms. Step 3. The site team is to post a notice on all construction doors that a confirmed COVID-19 case occurred on the job site and is to restrict access for the required period. Step 4. The Harbridge and Cross Safety Department and senior management team is to follow up with all external communication, including report to the Ministry of Labor within 4 business days. If a worker has been in direct contact with a member confirmed to have COVID-19 by a verified test, either a family member or worker from another site, the following measures are to take place. Step 1. Inform the Harbridge and Cross supervisor of your contact or exposure to a confirmed COVID-19 case. The job site will remain open. Step 2. The member is to immediately self-isolate for 14 days. Do not return to site until after the self-isolation period and you are symptom-free. Step 3. The Harbridge and Cross supervisor is to notify the workplace via memo or toolbox talk of the secondary contact. All workers are to self-monitor for symptoms. If members on site develop symptoms, they must report to the Harbridge and Cross supervisor and self-isolate for 14 days. Note: if primary contact occurs and results in a confirmed case of COVID-19, see the above measures. If a worker becomes ill on site or develops symptoms including fever, shortness of breath, or cough and is not confirmed to have COVID-19 from a valid test, the following measures are to take place. Step 1. Inform the Harbridge and Cross supervisor of any sickness or illness that is not confirmed by a COVID-19 test. The workplace will remain open. Step 2. The member is to immediately self-isolate and not return to site until you are symptom-free for at least 24 hours and without the use of fever reduction medication. Alternatively, you may be asked to get a COVID-19 test from an approved testing center. For more information, refer to the Health Canada website. Step 3. The Harbridge and Cross supervisor is to notify the workplace via memo or toolbox talk of an ill worker in the workplace. All remaining workers are to self-monitor for symptoms. Note: if primary contact occurs and results in confirmed case of COVID-19, see the above measures. Highlights. Workplace policy location. A copy of the Harbridge and Cross COVID-19 workplace policy can be found in the following areas: on the safety board, in the job site trailer, or with the Harbridge and Cross supervisor. The COVID-19 workplace policy is site-specific to each workplace and highlights the following measures, including roles and responsibilities, reporting requirements, communication plan, hazard assessment, control measures, and site-specific measures including access/egress routes, hours of operations, washroom hygiene, and PPE requirements. Enhanced workplace sign-in. The sign-in book is designed to track all members at the workplace and is an important tool used to communicate COVID-19 events. All members must sign in and out. All members must review the COVID-19 questionnaire. If you answer yes to any question, you must self-isolate. Do not enter the job site. Members must complete all fields on the sign-in book, including your name, company, contact number, and check mark that you comply with the questionnaire. Enhanced hygiene measures. In order to minimize the spread of COVID-19, Harbridge and Cross will implement enhanced hygiene cleaning. This may be performed by Harbridge and Cross staff or by a third-party cleaning crew. Cleaning will be performed at least 2 times a day and will include a wipe down of all high-traffic areas such as doorknobs, railings, facets, and countertop. Cleaning crews will also inspect and replenish cleaning supplies such as paper towels, hand sanitizer, soap, and toilet paper. Log records of the cleaning frequency will be kept with the Harbridge and Cross supervisor. Information signage is posted throughout the workplace, including main doors, inside the job site trailer or office, and throughout the workplace. These signs are designed to provide you information on physical distancing requirements, instructions on washing hands, and best methods to minimize the spread of COVID-19. PPE requirements. When physical distancing is not practical or reasonable on-site, or when performing specific tasks, members on-site are required to utilize specialized PPE in order to minimize COVID-19 exposure. This includes face protection such as face shields, DIY face mask, surgical masks, N95 dust mask or respirator protection. Thank you for your participation. If you have any questions about this or any other training program, please contact a member of the Harbridge and Cross project team or safety department.